Good evening. This is the third set of spotters for the MD medical practical exams. Already two I have uploaded. This is the third one. So again, another student asked, sir, will the follow-up question be in all the institutes, or is it compulsory? The question will be followed by a follow-up question. No, it might not be there. In the previous video also I told, if the in-person examiners are not there, it is being displayed in the slide format like in DNB exam. That might be timed one. Probably you might be given only 20 seconds, 30 seconds for each slide. So there might not be follow-up question. Only whatever displayed over there, you have to answer it. Each question carries 10 marks, something like that. So this is for MD Practical Spotter set 3. Each set is having 10 questions. Set 3, total of 10 sets are there. I hope you people are seeing this already. Two that have been uploaded. At least the current batch before your exam on 17th. At least see 2 or 3 videos so that you will come to know how these kind of questions uh, can be formatted and what kind of spotters you might be encountering. So let's start. Go through the slide. We'll start changing slide every 30 seconds. So what is the ECG finding? What is the diagnosis? What is the curative treatment? Uh, as I said previously, you should know how to read the ECG. Look at the findings over here. Sawtooth pattern. Yes, it is flutter curative treatment. I hope you know. Second is the blood smear. What is the peripheral blood smear? What are the causes? If whenever these kind of uh, clue in the question comes, it will be easy to predict the diagnosis. Just look at the blood smear, compare it with the RBCs, even focus on the RBC. What is the particular cell which is focused? Yeah. The question asks what are the causes? So what you are saying, okay, let me give the clue. Focus on the WBC, neutrophil, which is hypersegmented. And the second part of the question is what are the causes? They are asking multiple causes. So hypersegmented neutrophils, look at the RBCs, which are somewhat bigger size. So it might be, yes, some deficiency. What is the deficiency? What are the causes? And any other DD for this? Try to find out. Another simple X-ray. Again, they might ask you to read the X-ray if the examiner is sitting. If they are going for the direct, this kind of only spotter kind of question, finding, diagnosis, treatment. Pinpoint question, pinpoint answers. Very easy for a final year resident. Yes, it is the air pneumothorax. Fine. The treatment, you have to put a needle in the intercostal space or ICD have to be inserted. Okay, fine. Next one. CT, finding, diagnosis, and the clinical feature resulting from the lesion. Just look at the slide, try to make the finding. What are the findings shown over there? This area is hypodense. Here you are getting the choroid plexus calcification. So this area got impacted. So what is the most common vessel supplying this area? Clinical feature including the internal capsule, parietal lobe manifestations. What is dense hemiplegia? Where might be the clinical manifestation might be? What is the blood vessel supplying this? So these are some of the follow-up questions. Since after finishing your practical, theory just 2 days back, I hope you will be aware of this. Might be a very simple question for us. binary resident regarding the clinical manifestation, and this is what you have seen in the last 3 years in and out. Probably anatomy of the internal capsule, the pyramidal tract anatomy might be asked. These kind of anatomy, pyramidal tract you might have encountered in your long case only. So simple spotter. Fifth question, identify this device complication of the procedure it is used for. Able to make out. There are two, some white colored thing which is located over here. Focus over this side. Multiple chota dots are there. One clue I can give, it is related to kidney. Being a nephrology, I can say this is related to my field, which is related to dialysis also. Okay, let me give you the answer. It is a peritoneal dialysis catheter. Two cuffs, inside inner cuff and outer cuff. To keep it in position, this is the end which goes inside the abdomen. Okay, this is peritoneal dialysis catheter. Complication of the procedure. I hope you might be aware. During the procedure, after the procedure, PD failure, these are the complication. Another blood smear. Sixth question. What is the finding? What are the complication of this disease? This image is taken from Harrison only, the previous editions. I don't know whether it is given in the latest edition or not. It is in the previous editions, the banana shaped one. Complication of the disease. The disease spreads through mosquito. What is the disease? Just put banana shaped parasite in the blood. You might see this in Google also. Complications of the disease. So open the chapter of malaria in Harrison and look for this image, and you will come to know what is the subtype of malaria. This is question number 7. Adenosine, which is being used for PSVT, paroxysmal supraventricular tachycardia. Dosage and method of administration. In casualty, you might have used this drug multiple times for PSVT. How to give, which vein? These are very good questions that examiner will come to know whether you have used it or not, because you have to tell the technique how it is being used. A major vein and upper limb have to be taken very fast. You have to give, those are the stuff where the ECG rhythm changes very fast from abnormal to normal once this drug is used. Eighth question, again the drug amiodarone. Even in the previous water set also it was there. Now also it is there. So that means it is a very important spotter. Amiodarone. Many times you might have got this question in your theory only. They're asking clinical indication and the dosage. Dosage is very important. Even one more spotter set is there. Even in that also it is given. The next clinical spotter. What is the clinical and the radiological finding and what is the diagnosis? Again image from old editions of Harrison, the upper limb Reynolds phenomena or extreme of that, where the tips got necrosed. That is what you are seeing in X-ray. The clue related to it, you can find this in the rheumatology chapter of Harrison. You want to give option, the skins will become very thick in this patient. Still, if you are not able to find the answer and if your exams are nearby, let me know in the comment, or those who are having my personal number, just text me. I will let you know the answer, or just put it in the comment. The last spotter, Again, one or two mathematical calculation part will always come. Web 65, sodium, osmolarity, those kind of. So in this, we are having a 65-year-old female, type 2 diabetes, hypertension, shortness of breath, palpitation, tachycardia, normal BP, ECG showing atrial fibrillation. So what they are asking you to calculate is CHAD VAS2 score. At least in this slide, they are asking CHAD S2 score. What treatment would you give to prevent the stroke in the future? Another simple question. Try to calculate the CHAD VAS2 score. So those who are always used that mobile app QX calculator or whatever it is during your rounds without seeing what are the parameters which are over there, if you could not remember, you might find it difficult. If suppose you studied well for your theory, you will calculate it very fast. So this completes the set 3 of the spotter. Set 4 and 5 I will try to upload tomorrow and day after. Till January 17th I will try to upload 3 or 4 more, and with that I will stop, because there is no point in uploading further after your exams are over. I will try to upload another 3 or 4 before your final exam. Bye bye.